Evening, everyone. We go live now. Okay, now it's 8:30 p.m. So I hope everyone is stay safe and everyone have a good meal. Okay, today that we are very honored that to have invite very special guest, which is Dr. Noorasekin with us. Okay, hold on. Let me make a very quick introduction to Dr. Noorasekin here. Okay, everyone can see my screen here. Okay, so we are honored to invite Dr. Noorasekin because Dr. Noorasekin has been 13 years of experience in medical practitioner. Okay, and she's previously from Kementerian Kesihatan Malaysia herself, and currently she's been working to one of the clinic itself that we have 13 branches all over Malaysia itself, and she has stationed in KL Central. Okay, the name of the clinic actually is called Polyclinic Central Pawupatan and X-ray, and actually is under the Polyclinic Razi group itself. Okay, and one very interesting thing is like Dr. Noorasekin clinic itself have a lot of services other than the normal clinic. Okay, but one thing that actually most of the people do not really take note is that you need to be certified in order to have a COVID-19 medical officer, which is I did not know until that I met Dr. Noorasekin. Actually, that not every clinic actually can become the vaccination center. So from the profile that I look from Dr. Noorasekin itself, then I only notified that actually you need to get certified in order to get a vaccination, right, Dr. Noorasekin? Okay, so this is the brief history of Dr. Noorasekin, and the reason that we have these sessions or this event or this sharing in order to become a myth buster on the vaccinations, because a lot of people are getting a lot of information from unofficial or not verified information from here and there, from WhatsApp, from messages, from Facebook, from Instagram. I'm not sure how true is the informations that they got from these sources itself. That's why the reason that we have this event in order to invite Dr. Noorasekin to become our myth buster, okay, to verify each and every one of the information here. Yeah. So I mean, not to become a very lecturer type of information sharing here, because like I have prepared some of the questions to Dr. Noorasekin in order to help everyone to explain. Okay, so Dr. Noorasekin, so good evening. Yeah, you would like to say something to our audience itself for tonight?
Hello, everybody.
Okay, good evening, Dr. Noorasekin. Okay, I mean that let's go back to basic. Okay, what's the difference between the vaccinations that we have in the market currently in Malaysia? Because that what we have well known actually is like Efficacy, Pfizer, and Sinovac. What's the difference of these three itself?
Basically, obviously, I think the methods of to produce the vaccines itself is different between these three main ones. It's Pfizer, Sinovac, and also AstraZeneca. And then actually we have 5 types of vaccines available in Malaysia. Okay.
Oh, okay.
So, we only know that lots of Pfizer, Sinovac, and also AstraZeneca, but we have CanSino, I think from China, the names, and the other one's Jenson. So I think I will go through all these vaccines during the short lecture.
Yep.
Okay, can we start?
Yes, please. You can share your screen, Doctor.
Can you see my screen?
Not yet from my side. And by the way, the people who actually joining our Zoom sessions on our Facebook or Dr. Facebook itself, please do drop the questions if you have. My colleague will send some questions to me in order to ask Doctor on a live itself. Yeah.
Can you see?
I can't.
Why is it I cannot share this one?
Yeah, you just maybe just press the share screen again.
Right. Share screen. Okay. Share.
Yes, we.
Okay.
Yep. All yours, doctor.
Okay. Thank you for kind introduction, Jenson. So, Assalamualaikum and very good evenings to everybody. Right. So, I would like to introduce again myself. I am Dr. Noorasekin binti Saiman from Polyclinic Central KL. Tonight, specific, I would like to talk about a few topics regarding COVID-19 vaccinations, particularly in Malaysia. And honestly, I'm not a specialized or very qualified persons to talk about this, but I will try my very best to discuss briefly the topics given to me. So, which include how does the vaccines, COVID-19 vaccines work? Few types of vaccines available in Malaysia, and few side effects of the vaccines that we can see nowadays, right? So we go one by one. Okay. So before we go deep into the discussions, we need to know what is the meaning of vaccines. I mean, what is vaccines actually? Vaccine actually a product that stimulates a person's immune system to produce immunity. More specific is passive immunity for a specific disease, protecting the person from that disease. So what is immunity is a protection from an infectious disease. Immune is you can be exposed to it without becoming infected. Means that you have no symptoms at all or very, very mild symptoms. So immunity, actually, we can get immunity is either from active or passive immunity. For vaccines, we can get passive immunity. If let's say we have infections with COVID-19 and then we haven't have any vaccines yet, then we develop active immunity. Okay, right.
Doctor, maybe that I have a questions here. Okay, because there are a lot of people that have the myth itself or thoughts itself that after they get the vaccines, then I'm free of infections, which is not true, right?
Which is not true.
Yeah, which is not true. Okay, because that we have seen some from news itself saying that after get vaccines that you can go here and that. So those people that after get vaccines very happy already, so want to go for shopping, want to go here and there, want to go for travel. So I think the one thing that we need to tell the public after you get vaccine itself is not immunity. It's not like 100% bulletproof. Okay, meaning actually that you get the vaccines. Actually, after you get it, you will still get infected, and after you get infected itself, that the effect will be not so severe on mild, right? This is what it means. Okay, so after that you get the vaccine, you will still get infected and you will infect others people as well. So please do get this thing right. Okay, if not that you think that you have to get a vaccine itself, okay, I'm okay without I'm okay already, so I will not get infected. It's no. Okay, so you still have a risk to get infected. Okay, guys. Okay, yeah, this is what Dr. Shikin trying to tell you on this one. Yeah, thank you, doctor.
Right. So the main idea of vaccine is to train actually our immune system to recognize and fight off an infection before it has occurred. Okay, so basically, what is inside the vaccine? So vaccine actually consists a tiny, weakened, non-dangerous fragments of the organism, which includes parts of antigen. Antigen means the toxins of the virus. So we just take a few fragments, the bits of fragment together with swab and produce vaccines. And then when we introduce to our body, it's enough that our body can learn to build the specific antibody towards this virus actually. So then later, when this antibody will stay inside our body, then if the body encounters the real antigen, when we infect it, later we infect it, it already knows how to defeat it or how to kill it. That's the main purpose we get this vaccine.
So in layman itself, actually the vaccine is just like a trainer or a captain in the army to train our soldier, which is our immune body in ourselves, to train up when the virus come, how to defend themselves, right? So
we actually introduce the virus inside you. We introduce the virus inside you.
Imitation of virus, right? Imitation.
Imitation. I mean, vaccines is imitations of the viral and go inside our body, and then our body will recognize, and our immune system will build the antibody against this virus.
Okay, good. Yeah. Yes.
I think clear, right?
Yeah, it's good. It's clear.
So just to recap back again, how do the vaccine works? Actually, the vaccine, the patient is injected with a weakened, inactive, or harmless disease agents. Means that we have a parts of vaccine which is harmless. I mean, little bit only, just to introduce to our body. And then when it's enter our body, patient's immune system, our immune system react by producing their antibodies. So these antibodies actually to recognize the disease later. So just in case in the later on, the patient really being infected with by this virus, particularly this now is like COVID-19 virus, so coronavirus, their immune system is ready already, that's in ready state to kill these vaccines. To kill this virus.
Okay.
Right?
Yep.
So here, right? Okay. So before the vaccine comes to us, so actually they needs to undergo a lot of process, which includes first vaccine development, and then after that we go to preclinical trials, and then after that go to clinical trials, and then to government review and approvals, and then lastly quality review before they can give to us. So actually vaccines are very safe and effective, and they really save lives. So to help us combat this this virus, this infection.
Okay. Because I have some questions afterwards. So yes, please go on.
Okay, right. So continue. So apart from we develop ourselves, the antibody ourselves, from we can develop antibody immunity from passive or active infections. Passive infection is vaccines when we introduce ourselves to the virus. Active immunity we can get from if, let's say, individual have no vaccines yet, but already infected with this COVID-19 disease. So body also can produce the antibody we call is active antibody. Okay, so these two group of people, which is ex-coronavirus case, and also the group of people that have the vaccines, actually can protect the community to those group that we can't vaccinate them. They can't receive the vaccination. For example, children less than 12 years old, we cannot inject them with vaccines yet. So so maybe a group of that have a very severe infections or severe underlying chronic disease that not permit them to get the vaccine. So in other words, apart from protect ourselves, also protect the community around us to those not able to get the vaccines yet.
Yep.
Okay, right. So basically herd immunity, also known as population immunity, is the indirect protection from infectious disease that happens when a population is immune either through vaccination or immunity developed through previous infections, like I mentioned earlier.
So
Okay.
what Dr. Shin telling us actually is not possible to get 100% everyone to get vaccine, because some however, I will believe, because why? Because there's non-believer, naysayer, and some also is like very out of reach, which is like I mean, people who staying very far from the city itself do not have that kind of information to get vaccination. Okay, but if all of us is mainly like 70%, 80% of us actually get the vaccinations, then we can protect from it. This is what you're trying to say, right, Dr.
Yes,
Noorasekin?
true. Yeah,
Yeah.
true. So that's why Malaysia try very best to get a lot of people to vaccines to achieve this herd immunity, so we can control the disease inside our community.
Yeah, and this is also one of the objective of this event and sharing. As a responsible citizen in Malaysia itself. Why I say so? Because that a lot of people itself still have doubts on vaccinations. Honestly speaking, I believe that still a lot. I do not have the figures, but I believe that there's a lot of people still not registered itself and think actually it's a hoax. It's just like Donald Trump saying it. Okay, COVID-19 is a hoax. It's a hoax. Okay, so it just make it up by someone in order to like influence the political or whatever. It's like it's just a theory. It will not happen. Okay, so that's why we will try to become a myth buster. Okay, if you not really believe in it, okay, I don't want to go. Me myself, okay, I have a very high respect on the frontliner itself, because my mom actually is a nurse for more than 30 years, and my sister actually worked in HKL as a dietitian. Okay, if it's not really happened, why my sister is like so busy, or like it's like to taking care of the patients, of the nurses, or the doctor itself, so busy of taking, like, if nothing happened, right? So that's why that actually it's not a hoax, it's not a show, it's not because of the political issue or whatever. Okay, so this is actually is protect yourself. Okay, and getting vaccinations in Malaysia is so fortunate that we are not paying it upfront. Okay, of course,
Yeah.
I mean, money is come from the taxpayer, but we ourselves is not taking from our pocket money to buy it. Why not? Right? Okay, so Dr. Noorasekin also have shared with us the vaccine is safe. Okay, but however, doctor, I have a questions here. Okay, because that we receive, okay, again, we receive some information saying that after taking the vaccine itself, there's a fatality rate itself. Is it true? Because like put in blank itself, after people take vaccine, people actually have some side effects. Not only saying that headache, not saying like fever. It's like effect like cause that. Is that have a possibility to happen?
Yes, still there is a possibility to individuals susceptible to especially has underlying severe allergies, that kind of things. Maybe because this COVID-19 vaccines is very new, so we still studying. Okay, so the thing is like everything got side effects basically. So we just try to monitor, and we recognize a few fatal complications to a certain vaccines, but the number is very, 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 very small. So it's outweigh the benefits from this vaccines basically. So that's why we also have guidelines to vaccines. So that's why we choose appropriate groups, you know, and then study them as well. You know? That's why this COVID-19 infections is very dynamic. So for time being, we have a few vaccines that can cover. Efficacy is more. Some vaccines is no, and then some vaccine can give such a bad complication, some is not. So we still studying everything. So it's the there is a chance to have this fatality there, but so far it's very, very small. So we still want to continue the vaccinations because we think that it can bring lots of benefits rather than
I do agree with you, Dr. Noorasekin, because why? Because put in a very another different perspective, saying like dengue. Dengue have been around in our society like 20, 30 years, but it's still a fatality rate on that, right? So
yes.
Nothing is like 100%. If you're
Yes.
telling me that everything is 100%, it doesn't appear. Okay, it's just like we have been driving our cars for 30 years, 40 years, 50 years. It still happen accidents, yes, because of some reason. It's not because that misbehavior of driving itself. In come back to these vaccinations in COVID-19 itself, because of that, because everyone is unique. It's not everyone is the same. Everyone is unique, and your body condition will be different, right? And for example, if you have a heart attack issue before, you have a history of a heart attack, you have like high blood pressure, you have a high cholesterol, probably will cause this happen of fatality. Am I right, Dr. Noorasekin?
Yes.
That's
True,
why
true.
that
Very true.
that's why that, because me myself, I can share a little bit because that I already get my second dose itself like last week itself. Okay, so because during this process itself, another another applause to the frontliner also that some of the vaccination center, they do it very well, because that before that you go for vaccination, actually they have a doctor, professional doctors actually is stationed there in order to explain to you actually in some certain condition, actually it's better for you not to take the vaccinations. Actually, yes, this is how we actually prevent this happen, right, doctor?
Yes, yes, true. That's
yeah.
very
Yeah. So yeah, doctor, you have some more slides to go.
Yeah.
Yeah.
We'll just continue. Okay, so we go to the second section, second segments. Types of vaccines, particularly in Malaysia. So as I mentioned earlier, we are very familiar with these vaccines: Pfizer, AstraZeneca, Sinovac, CanSinoBio, and the other one is Jenson, right? But this one is not updated. So I get this from our latest actually. So this one just updated. So basically this one just to as Jenson asked, what is the difference between Pfizer, AstraZeneca, Sinovac, and other. So the main difference is how they produce the vaccines. The newest method is through by using mRNA, messenger RNA. But I don't want to go into deep of this because it's very complex. So different vaccines produced by different methods. That's the main difference. So Pfizer from using mRNA, not DNA, okay? So mRNA. AstraZeneca from produced by viral methods. Sinovac inactivated virus, so means that use the kill virus put inside the vaccine. So CanSinoBio also using the viral vector. Viral vector means that we use different cells, we have a vector, different cells maybe from human or chimpanzee, or then just introduce to and then produce these vaccines actually. Okay, so right, so
Dr. Noorasekin,
yeah.
because I'm a layman, so I'm looking at the efficacy itself. That to me it seems like efficiency to me. I'm not sure whether it's the same meaning or not. So the efficacy, it seems like Pfizer is 95%. So is it the most effective one? Because that I go through some of the YouTube or tutorial itself for the efficacy. It seems like it's not so important, but is it important really?
Yes, it's important because this is from WHO standard. Okay, so the efficacy means that just now I said that when you go clinical trials, preclinical trials before we get the vaccines, right? So we actually measure the efficacy there, right? So efficacy means that keberkesanan of this vaccines lah basically. So WHO put the standard. If let's say the efficacy for a specific, for each of vaccines is more than 50%, then you can use.
Okay.
So as I said earlier, this number also can change because this virus, this infection is dynamic. So it can change. Now we have a problem with variants of concerns as well.
Yeah.
Okay. So
telling us actually this is a live thing. It's not saying that we have a magic bullet for everything is the same, because that it go to your body, it will become a dynamic, a living thing. So to you itself, that has certain level of the efficacy. So to some others people may have different efficacy. Can I say so?
Yes.
Yeah.
Yes, true. I will share this efficacy slides later.
Sure.
So this one also change. The number also changing actually. But this one I think is we put here because this WHO standard. So all if like say the efficacy more than 50%, then we can recognize these vaccines and we can use this vaccine.
But one interesting here I did not know before today itself or to now itself, that is on the casino bio itself. It just need one jab. So it means that if we can do everything with one jab, so we can fasten up on our herd immunity, right?
Okay, but yeah, the herd immunity. But we use this. We reserve this Sino bio and also Jenson's, to those who are live in a remote area.
Oh, okay.
We cannot achieve them. So when we give the vaccines the F2 dosage, so basically sometimes we cannot get the compliance. Means that we can give the first vaccine and then after that second vaccine hilang. So we can so we reserve this Sino bio and Jenson's to those who living in a remote area like orang asli and all those things. So we just go in and jab them. That's it, and then we go out.
Yeah, I saw the article. Because that on this one jab vaccination is reserved for those aborigines in Sabah or Sarawak itself, right?
Yeah.
So means actually Jenson's and also the Casino Bio actually is for one jab only. So we have that. Okay. Thank you for the sharing.
I go to the next slide. This one also a very complex slides actually. So they just trying to explain how this mRNA viral vector inactivated virus, how to produce the vaccine stuff. So mRNA basically is a Pfizer and Moderna, and we are using viral vector method for AstraZeneca, Sino bio, Johnson & Johnson and Sputnik V5, and also inactivated virus for Sinovac is using this method in So this one, the slide of efficacy. Just now you asked for efficacy, right? So why is it different? So how well the vaccines work is seen through its ability to protect individuals from the symptoms of COVID-19 through vaccination. As I said earlier, it's a very dynamic process. It's very dynamic disease. So different people, different symptoms, different people, different call that response to vaccines. So the efficacy level varies according to the way of clinical studies. This one is for the vaccines itself. Are conducted, the type of vaccine, the risk of disease in volunteers, and various other factors. Okay, I think it's include also the cost of the vaccine itself. So to achieve a herd immunity, so different countries have to know that they needs to choose appropriate vaccines so that they can achieve the herd immunity.
Okay.
Okay. As I mentioned earlier, WHO prescribed that minimum level of efficacy for the COVID vaccine is 50%. So if let's say it's achieved the 50% during the clinical trials, then we can use that.
Okay.
Right?
Yep.
So who should take the COVID-19 vaccine? So nowadays we are injecting age 18 above, and those with comorbidities. Comorbidities means that they have underlying chronic problems like hypertension, diabetes, all these chronic disease, right? And thus those with comorbidities should be vaccinated to protect themselves from suffering the effect of severe infections. So,
Dr. Shikin,
yep.
because currently that we are focusing on those 60 people, 60 years old veteran, I will say that in order to get them protected first, because they are on the high risk group.
Yes.
Okay.
Yes.
Yeah. Yes. And then starting that we can see is like now it's 50, 40, 30 itself, or even 20s to get the vaccinations. Okay. But what about our kids itself that is like below 18 years old? That
Okay.
is it will be the last stage of the vaccinations process, or is not advisable for kids like below 18 to take vaccinations?
Okay, so this vaccine actually, all this COVID-19 vaccine is very new. So usually for to make the vaccine stable, actually, I mean, usually we need at least 8 years to develop vaccines, and then we have to go for a lots of clinical trials whether it's safe or not in children, old age and adults and all these things. So nowadays, because of this pandemics, so the trial to children's, we have limited studies. So that's why we try to vaccines more of adult first, and later we will study about the safety in the children. So that's why we can protect them with this herd immunity actually.
Okay.
Because
so means that we become the guinea pig first, see whether we are okay or not. Then follow by them.
So because the safety measures there, still there is no many studies. So it's very dangerous for us to introduce this vaccine without we knowing what will happen, what is the side effects and everything. So we need time actually to really develop the vaccines that's suitable for the children and everything. So nowadays we are Pfizer also can use at least 12 above, but we haven't started yet, right? Children we can use 12 above. 12 below we still cannot. I mean, there is maybe because of safety measures.
Yeah, because I have concern on my daughters as well. One is 4 and 7. How about them?
That's why the parents have to have a vaccine to to protect them.
Okay, thank you.
Okay.
Yes.
Slide just want to highlight the high risk group eligible for vaccinations. So all the the group we prioritize to them because every day we hear about the mortality rate is very high with all these comorbidities, right? Okay. So even though vaccine is good, we try to vaccine everybody, but still there is a group of people that we cannot vaccine, right? So it includes the patient we have a very severe allergies, can go to shock and everything. So sometime after receiving the first dose, they already developed this severe allergies. We will stop them. Okay. So and we put precautions to all the patients that have a severe allergies to other vaccines as well. So we also will ask the question whether you have any side effect from the other vaccine before.
Or antibiotic, is it count?
So far, antibiotics is okay, no problem.
But what is the meaning of anaphylaxis?
Anaphylaxis is a medical terms that begins with severe allergies.
Okay.
And then can involve your lungs, circulations. You can just unconscious.
Just like people have the very severe allergies on peanuts until they can't breathe, or you have rashes or something like that, right?
Yes,
okay.
Rashes is very mild.
Yes.
When it's involves the lungs basically. So you have this shortness of breath, very noisy breathing and all those things, shows that it can constrict your respiratory tract.
Okay.
Okay. So this one slide. Okay, we go to the next section. Side effects of COVID-19 vaccines. So I go just briefly for the Pfizer. As of every vaccines that we get, very common one is injection site swelling and redness, inflammations, like I would say, right? So generally they will complain about joint pain, lethargy, fever, feverish, headache, and muscle pain. Myalgia is muscle pain. Okay. Very, very rare complication would be anaphylaxis just now. Severe allergies can cause the involvement of the lungs. And myocarditis and pericarditis, actually the inflammations of our heart, like lining tissue lining.
Can I ask on behalf of my colleague? She has the side effects on have migraine. I mean, it's not migraine. I mean, like she will like a little bit headache here and there. She did not have migraine before. So after taking the vaccine, so she have like, I don't know whether it's the FMCO pressure or whatever, but it just coincidentally after she take the migraine, the vaccine itself, then she have a little bit headache here and there. It's mild, but it's very annoying. I mean, sometimes
I would say this non-specific symptoms.
Okay.
And it's if let's say it's very mild symptoms and it's a common, very common. I mean, for the Pfizer also, headache is one of the common symptom.
It will last forever, or you will be.
It's not. Usually within 48 hours.
But she have more than that already. She been took for weeks already. So she still had it. So what she need to do? She need to consult the doctor again, or how?
And can go to the doctor back again. Maybe we need to find other cause of headache.
I think it's the pressures from FMC go lah. So
maybe.
I'm not sure. So she's listening like anyway, so she will get the advice. Okay.
Yeah. Okay. So this is for Pfizer. For the Sinovac also the same, very common. One is injected site pain, erythema, main redness, inflammations and all that. And generally, for the general is like a lethargic, fatigue is lethargic and very non-specific headache. The rare complications will include muscle cramps, swelling of eyelid, more of like periorbital edema. The allergies lah, basically nosebleed, bloating, constipation, diminished sense of smells, hot flash, hiccups, eye redness, very non-specific things. This one is very rare. So usually we go to very common one lah, basically. Yeah. So this one for the AstraZeneca also the same thing. Local injections at the site of injections would be pain, tenderness, warm, some maybe it's itchiness, and also bruising as well, blue-black skin discoloration. Right, generally they have headache, like nausea, muscle pain, and joint pain without the inflammations, fatigue, malaise, lethargy, pyrexia. Pyrexia means that you feel is either fever with high documented temperature or feverish. So no documented temperature. Okay.
Pyrexia is you got fever and?
Pyrexia is either you get fever with high temperature or feel like feverish, but when we check, no fever.
Means that you feel the body heat is very high. But actually
but the temperature is not raised.
Oh, okay. It will happen like this.
Yes. Yeah. You feel like feverish like that, but when you check, temperature is normal.
Oh, okay. I didn't know that. Okay. So guys, this is the reason that we have doctors to go through the 4 years of medical study. Then we know this. Okay. If not, that we will not know. Okay, good.
Okay. So previously got Isaac also have a problem with thrombosis right before. It's very kecoh before. It's very, very rare. It's less than 10,000. I think it just ignore lah.
But very rare on neuroinflammatory disorder. What is neuroinflammatory disorder? It means like you will numb or how? You will be like paralyzed or what? You paralyzed, right? Seems like that from the wording seems like very serious and seems like you were paralyzed.
Neurons.
Yeah.
Can cause a lot of. It depends on.
Oh, sorry. Your last word is breaking up. Sorry, Dr. Nisha.
Okay. So neuroinflammatory means that inflammations of the neuron. Nerve.
What? Not enough. Sorry.
Nerve.
Nerve. Okay.
Your nerve. So the manifestations of symptoms is different. It's either you can get numbness, like you said, worst come to worst is a problem with the paralyzed.
Okay, but it's very rare. Okay.
Very, very rare. Very rare.
Okay. I already got some questions from the Zoom itself. Okay, I already take note. Okay, so I will ask after Dr. Noorasekin present on the last slide. Okay. Yeah, Doctor.
I think this one just to show you the successful story of vaccinations. So this one is the study in US actually. There is a few infectious disease that been successfully eradicated, means that we can remove from the community through vaccination. Okay, for example, diphtheria, polio, tetanus, pertussis, hepatitis B. This is data just to show you actually vaccines can do a lot of contributions to our society, especially to the infectious disease, right? So this one from the Canada data as well. So all these, different type of infectious disease that can benefits from the vaccines that vaccinations program. So before, you can see a lots of cases there. Now is we almost can eradicate the disease itself. Most of the disease here is more in the children.
Oh, okay.
Right. So in Malaysia also, I get this one. I just want examples. In case of rubella, so we did vaccination also. Vaccination start 2004. So you can see the number. But surprisingly, in 2012 and 2013, sorry for the very bad slide, a rise of rubella. This is because the emergence of anti-vax.
Dr. Noorasekin, the polio itself, is it the one that we took during our standard 6 or something like that for the PCG? Is it named as PCG? PCG is what?
Tuberculosis.
Okay. It's not in this.
TB.
It's not in this list, lah.
No.
Oh, okay.
So this one is more actually BCG. We injected newborn, and then after that, as you said, during standard 6.
Yep.
Okay.
So it's the same thing that actually we going through, right?
Yeah.
But we are very fortunate to live life now because of this pandemic, right?
So actually, this is an example only. It's not like I can get little bit here and there just to share a bit. So this rubella also in Malaysia. This is a statistic in Malaysia. It shows that vaccinations is very good. That can reduce all the incidents and the acute. Right. So if everybody listening to my talk just now, so I think you can see these myths and you can try to reason up whether the myths is really real or not real, right? So for example, the first one, COVID-19 vaccine alters DNA, but our vaccine is mRNA, it's not DNA. So mRNA doesn't enter a cell's nucleus and cannot change DNA. So we are use mRNA actually. DNA is inside the cells, that's inside the nucleus.
So guys, you will not get taller, you will not get shorter, you will not get fatter, you will not get slimmer by doing this vaccination, okay? So you will not get another smart kids after get the vaccinations, or you will not, so you will not change. You will not change who you are, basically, okay?
So,
so this is
we mentioned DNA, RNA. It's not our DNA, it's not our mRNA. It's the virus mRNA, it's the virus DNA. We alter the virus DNA, it's not ours RNA.
Yeah. So it will not be part of your body, it's just like outer of your body in order to protect you, right?
Yeah, something like that. Replicates just to, this one is just a segment of the virus we introduce.
This one is very important because there's a lot of people spreading the news saying that after that you have take this vaccination, will change your DNA, then you will have like when you're giving birth, the child will not be perfect or something like that. It will change here and there in order that the pharmaceutical company can earn a lot of money in the future or something like that. So it does happen that on this naysayer or non-believer on the vaccine. Yeah. But it's good that we point out on this one. Yeah.
The myth is it isn't safe because of rollout. Actually, it's not true. because we go through the 5 steps just now. Thorough safety standards and trial we met before we get these vaccines.
But we need to agree one thing, like we are rolling out these vaccines a little bit rushed, but we gone through the protocol of trial and error lah. Right?
We need to go through that. We are not guinea pig basically. You just inject you and then see what happens next.
Yeah, because
Right.
because that the leader of the country is the first one who took it. Many of the countries, not only Malaysia, and also that the frontliner is the one who took it first. Most of it, okay. If the frontliner is been taken, okay, and anything happened to the frontliners, what will happen to us? If the frontliners all been vaccinated and have issue, right? Then the whole world actually is collapsed, right? Yeah, this is what my reason behind that I feel safe to take the vaccination is because the frontliner, the people is smarter than us, the people richer than us, people with more knowledgeable than us is already taken. So I don't think that I'm smarter than them. So that's why that what's my loss, right? So that's my reason. Yeah. So guys, so for you that still have doubts, please think twice and please get vaccinated. Yeah.
Good advice. So
Yeah.
other one is food allergy, immunocompromised, breastfeeding or pregnant people can't get the vaccines. Actually, nowadays the guidelines, all the pregnant women also can give the vaccines, provided they are 40 weeks, 33 weeks of pregnancy. And all the lactating mothers also can have these vaccines as well. Previously, yes, only Pfizer. We can use Pfizer. Now, all Pfizer, Exact, and also Sinovac we can use in pregnant women and also all the lactating mothers.
Okay.
Okay. The fourth one, I will get COVID-19 from the vaccine. The fact is the vaccine cannot give you the virus. It protects you. Actually, yeah, we just introduce little bits of the virus to tick your immune system to produce the antibody. That's all.
But this one actually that people have a lot of concerns on this is like 2 days ago that we have been reported that we have 3,000 over people frontliner been get infected, and also that in one of the vaccination center have the one of the highest cluster itself after get vaccinations. But actually it's not when you take the vaccines that you're free with the COVID virus. It's not. I think it's because that it got infected is because that the SOP is not being followed. And
a lot of people.
Yeah, a lot of people, the crowd control is not there, the crowd management is not there. I have been to some of the vaccination center itself to see the crowd control really is not good. Okay, the one that I have been to is Setia Alam Convention Center, which is very, very good, although it's like a lot of people, but the crowd control is very good and I don't feel crowded at all, and everyone is like at least like 3 to 4 feet away from me itself, and every step by step, and it's very fast and smooth. That's why that the vaccination center actually that maybe the crowd control is not doing well. That's why causing this one. What do you think, Dr. Noorasekin? This is what I feel because I do be in some of the vaccination center is very crowded, and the crowd control maybe because that I observe actually is some of the vaccination centers, they do not have the experience in the crowd control. They've been appointed, they just newly been appointed to become a vaccination center, and then suddenly that all a swarm of people is just swarming in, and they do not know how to control the people. Yeah.
But like I said earlier, although you already completed your vaccinations, doesn't mean that you kebal lah. You can still get this virus, this disease, but in the milder.
Okay.
So it's not like you are not going to have this disease at all. So it means that we try to vaccinate people to reduce the complications, to reduce the not like it's not like we can eradicate this virus.
Yeah, truly understand. But I'm just trying on. I mean that to stress out actually the point of view as a public itself, because that when we want to go for vaccinations, we don't want to get the virus. The first thing from the vaccination center, which is like
Yes,
yeah.
Very
So
unfortunate too.
the last thing we want is like to get the virus from the vaccination center, which is like making no sense, right? So that's why
Yes.
that's why I'm sharing based on my my experience of what I observe is because the crowd control on the crowd management itself. So I hope the people out there actually take note on this. I don't think it's because the vaccination will cause the virus
No.
because of the crowd control, because like people who got infected, but the crowd control is not doing good, the protection is not doing good, you still will get infected at the vaccination center. Yeah.
True enough. Ideally, if let's say we can screen everybody before go to vaccine also, I think it can protect as well. But the thing is like, this cannot be implemented because of the cost and everything, right?
It's not feasible. I mean that after you test, you need the PCR test will take like at least 8 hours. Then after 8 hours, then you only
No. Now we have a kit that we can we can swab you, and then we can see the results. It is screening. We can screen within few minutes. We can get the results.
But few minutes actually play a very important role, because that the whole process of my vaccination will not take more than 15 minutes for me. I mean that 15 minutes observation time, but to get the vaccination only few minutes time. If you add in another few minutes itself, that we will not reaching like 400,000 over vaccinations a day.
Yeah, so actually it's ideally, but the thing is like there's limitations to everything. So very unfortunate to get the virus again, the infections during the vaccination day.
Yeah, true. So the last two, I have COVID-19, so I don't need the vaccine. We already told you the so best of luck. So
yeah, now previously we defer all the the post-infectious individual with COVID infections 3 months before we get vaccinations. Nowadays, we see at the category. So some of the time, if a very mild category, we try to vaccine them as soon as after they discharge from the the quarantine. So because of this AOC basically variants of concerns, they can be infected again.
So after they get the COVID itself, after they recover, what is the period of time they need to get the vaccinations?
Okay, depends on the category. Which category? So there is a category for
the one that recovered. The one that recovered, I think is
recovered is from which category? Category 1, 2, or 3, or you have to be admitted in hospitals, or you have to take a few treatments.
Maybe we just take a mild one. Just quarantine at home after 14 days. Then I feel okay. I go back to the KKM. Then I cut my label already. Then the very mild one, stay at home one.
Yeah, you can immediately
after the
provided you don't have any symptoms lah.
Okay.
So you provided you have no symptoms, we have no issue to vaccinate you as soon as possible. Except for the people who are getting these treatments, hospital and all that, needs to defer.
Okay. So the last one, which is like no need for mask or social distancing after vaccinations, is a myth lah. Okay, as we already earlier have mentioned that you still will get infected after you get the vaccinations. Okay, so the protection still be needed lah, right, Dr. Noorasekin?
Yes, true.
Yeah.
We still have to practice all these SOPs, right? Actually, because we still have a risk have this. I mean, to reinfected by this disease again.
I see. Okay. So, Doctor, do you have any other things else? Or yep.
I think this is my last slide.
Okay. So everyone know my chart is very important in order not for you to scan when you buy food, but also like to get registered on the vaccination as well. Yeah. So I have compiled few questions from the audience from Zoom and from few areas itself. Okay. One of my friend here asked, okay, I had done my first dose Sinovac, but didn't feel anything. So it did work for me. Same goes to me. I take 2 doses from Sinovac. I also did not feel anything. I also did not know whether I already got vaccines or I get the empty injections.
As I said earlier, all the side effects varies among the individuals.
Okay.
So it's not standards to everybody. Sometimes some individual have this fever. Sometimes this one have headache. This one have rashes. For me, I have only rash.
Oh, okay.
Just a mild rash. And then the second dose, I feel feverish like that. I mean, no temperature, but it feel like fever, but no temperature documented. So it varies. But my husband's have a second dose, very high fever for 2 days. So it's very different between people.
I see. So another our audience asked that what kind of food that we should avoid after the vaccinations?
There is no specific lah. I don't think pantang lah.
I think our body will tell us which one that actually that you feel take it or feel not take it. When you feel your
if you have rash, try to avoid something
when you feel rash, you have rashes, you should avoid what kind of food? Sorry, Dr. Noorasekin?
Maybe that can increase more itchiness. Some eggs, white eggs or peanuts and all those things.
Oh, okay. The items actually will cause the inflammation stuff, right?
So increase which contributes to more itchiness, more uncomfortable after rash.
Yeah, but actually that we have already passed 1 hour very fast, although that we only cover a few topics, but the time flies. Do you mind that just spend another like 10 minutes with us, because there are a few questions to like really go through very fast. Again. Okay. Then there's a rumor saying that some batches of vaccine is not advisable or recognized by some countries. So what should we concern about this? Or any batches actually will work? Actually did not concern, because they believe because that some batches actually is not recognized by countries, then they kick to Malaysia, then Malaysia just accept it. So what do you think about this?
I heard about that. Actually, it's because of efficacy, maybe because the efficacy, and different countries, different efficacy, if I'm not mistaken. I mean, no, this one is very hard to tell, because
the perceptions of the vaccinations of certain country will be different. So it's based on their perceptions and acceptance level, right?
Maybe, yeah. Basically, everybody's is closed, right? You cannot go anywhere. So the main thing is to produce the herd immunity first, and then I think that is more important.
The rule of thumb is just to get vaccinations. Where it come from, just don't bother first. It's not the main.
That is my personal view. I mean, in my opinion.
Yeah. Me too, me too, me too. I'm with you. I'm with you. Don't worry. Okay, and then the next question, very fast one. Actually, that previously we heard that the first dose and second dose vaccine will be mixed, if not sufficient. But now seems like we have sufficient. It's not been mixing. I never heard of friends or families of mine is getting mixed. If like first and second dose with Pfizer will be Pfizer, AZ will be AZ, Sinovac is Sinovac. So what if like AZ mixed with Pfizer or vice versa? Is it any bad side effect will cause by mixing the vaccines?
Yeah, from latest consensus, I mean, from the CPG as well, we
Okay,
are not allowed to
not
mix.
allowed. Not
Yeah,
allowed.
not allowed. We
Okay.
are not allowed to mix the vaccines yet.
Okay, good formulations that we know that in Malaysia we not allowed. Okay, so then we don't have this problem on the mixing.
Yes.
Good.
Yeah, not allowed.
So okay, we have talked about the side effect just now, but after that we get the side effects. Actually, is there any method that we can reduce the side effects?
Reduce the side effect means that after the
Yes,
or
for example, like because that you have listed down a lot of side effects, because like each side effect
yeah.
will have a different cause, then you will have different cure. So we don't have a magic bullet on that. Let's put it the very common one, like high fever. Should we take Panadols or like paracetamol? I mean paracetamol for the kids, but for Panadols in order to reduce the issue.
Yeah, if there is a documented fever more
Okay.
than 8 degrees, you can take the paracetamol. It's okay, no problem.
Okay. So there's a question from the Facebook itself that okay, after the injection, can we take durian? Okay, because durian is very heaty lah. It depends. I mean, like Dr. Noorasekin have mentioned that you can take any food. If you already feeling having a fever, you still want to take a durian, I don't know what to say lah. Huh? It's your own choice, right? So
You can experiment yourself and see.
but actually there's no guideline, there's no saying that after taking the vaccination you can't take any kind of foods, right, or beverage. So but try not to be so extreme. I would say that sometimes that after you get a vaccination you want to be efficient, to good to your body. Try to take mild thing. Don't try alcohol, don't try durians, don't try laksa or whatever very very spicy in one shot or something like that. Maybe that few days after, then you just take like I think it would be I think it would be good. Although I'm not a doctor, but I think that I'm listening to my body itself what in need on that period of time, right, doctor? What do you think?
Lots of patients ask me about these durians as well.
Really? Because it's durian.
And no problem.
Yeah. So John, so the one that who asked the question, that you can take durian after the vaccinations. So then okay, another actually is I think it's a joke. I mean, like you can see a lot of Facebook or Instagram or people like showing that after vaccination you put the spoon there, they will stick at your arm thing. Have you seen it, doctor?
No, that one I haven't seen.
You haven't seen?
What one is it?
Oh, because that after they're trying to like I don't know whether it's promote or trying to
magnetic.
I think it's a prank thing lah. I mean that after you take the vaccine, then you put the spoon there, the steel spoon, then you will just stick on your arm itself. It's just like have a magnetized after that you get
mainly on Sinovac.
Yeah, but actually that we have few friends who have tried before. Not even take a vaccination, you also can do that, because that you have a sweaty arms. You just stick on it, you will be like that.
So
I don't think we need a doctor to tell us whether it's true or not, this one. Okay, so then some recommendations is saying it's not advisable to exercise after the vaccinations. So is it true?
I don't think so. Why not? So maybe if like you have a muscle pain, you have a fever, not advised. Lah. I mean,
So back to square one. If your body telling you not to do it, don't do it. Don't push yourself, right? Yeah.
maybe the extreme exercise, no lah, basically, right? So
So
because you have the side effect.
okay, this one maybe that Dr. Shikin can help us to answer as well. Actually, that one as a normal public, when we go to vaccination center, do we have some rights to? I mean, it's not. I mean, when I say rights, it means not very demanding. What is our normal things that we can allow to do at the vaccination center? Can we allow to ask the doctor, okay, doctor, can I take a photo during my vaccinations or take a video taking the vaccination? Is it any rules saying that we can't take it or not allowed to take it, something like that? Can we have the rights to actually take the photo and take the video during the vaccination center? In order for a record, in order for our well-being.
By right, before this, all the procedures that we do to the patients, we try very best. We ask the patient not to report lah, basically. No? That's the I would say is a must, but is
not advisable.
Not appropriate. Not appropriate. Something like
not that. Appropriate.
So not appropriate. Take the pictures during the procedure, unless but we are encouraged to show to the patients the shrink that we already draw the patient before inject.
Okay.
We encourage to do that, and then you can ask. You have a right to ask. You have a right to see the shrink, whether it's already the vaccines already drawn inside the shrink.
Actually, it's a mutual respect lah. Means that if you ask politely, if the person allowed, then you take law. If not, then don't take law. Right?
Usually, better ask first lah. You know, some doctors are. I mean, some
vaccination center.
Our staff, medical personnel are not very comfortable with comfortable. Sometimes it can what we call that can disturb your concentration, sometimes like that. Okay, but the thing is, like, the vaccine injections is very simple. I think most of the time they can report. For my patient, I do fine.
Okay.
Because we are doing the right things. If, let's say, you want to hide something, so then the procedure is very simple. Just to shrink out and then give it to you. That's all. That's a simple procedure. But it's good manner to
ask
just
before do so.
Get a picture.
I very polite when I did ask, and I do take the video. As long did not take the person face, because like you just want to record, but you just take the arm and
for your own collection.
No, just to tell our grandkids what we have been through during our days. So then I mean that we almost cover everything. So do and don'ts after the vaccinations we have also covered. So don't excessively overuse your body. I mean, just take it as normal thing after the vaccination. If you feel nothing, then it's good, and you are lucky for it. And you feel not very comfortable, just as what Dr. Noorasekin saying, that take more rest, water, and also that if you feel you want to take the Panadol, take the Panadol. If you're very severe after vaccination, so please revisit back to the doctor itself, right? Yeah. So, Doctor, I cover everything in my questions here. Thank you for your time. Do you have anything to tell our audience here before we have our ending sessions?
I really hope that these sessions can be benefit. I mean, to encourage, this session can encourage more people come forward for vaccinations. So we nowadays, I think the latest one, 18 thousand, right? 80
Sorry?
million. 80 millions, right? Registered with my Sejahtera.
Yeah, but we have 32 million populations in Malaysia.
Yeah, so only 18.
But however, we need to exclude the kids or whoever. But
Yes,
I think we have 18 million. Seems like we are progressively, but I don't have the figures actually that we need to reach.
The latest figures, I think it's around 18, 19 plus, right?
Yes, we have a long way to go, but need to be patient. And however, now we need to be safe, get vaccinated, and stay safe at home yourself. Don't kesana kesini, really. I mean that this the most important thing. I mean, people still some of people still stubborn. I would say I don't have any word to use. I think it's stubborn to really doing something that you should not do it lah. Okay, just like what happened to our neighbor country, they have nearly close to zero, but suddenly some stubborn people go to KTV and then you have a KTV cluster. So this is the things that you can avoid and to protect yourself and also the public and also your family. Yeah. Doctor, do you mind to stop sharing itself that I have one very important slide to share with the audience itself before we end the session? So last but not least, so Doctor, this is the appreciation certificate we want to send to you via online now because that we can't see you, see you from face to face. And this one we will send to your clinic. I think my colleague actually can send you the certificate courier to you now. I will visit you after this pandemic over because that your area actually in KL Central itself actually is more than 10 km for me itself to visit you. But last but not least, I really appreciate Dr. Noorasekin actually has spent more than 1 hour time from your precious time after a very hectic schedule. After that, need to help the patients to take the vaccination for the whole day and still have a very quick dinner and spend so much time with us in order to educate our public itself on the vaccination itself. Yeah. Thank you, Dr. Noorasekin. Thank you very much. Yeah.
Thank you for this opportunity. At least, make it clear lah. If somebody is not clear about the vaccines, so hopefully, it can clear the misunderstanding.
Yes. So anyone actually that want to consult with Dr. Noorasekin, actually you can contact Polyclinic Central Purubatan and X-ray in Station Central in Kuala Lumpur itself. Okay, so please do so, and because that Doctor Clinic itself actually have a very long list of services that can provide. Because that is too many that I can mention: the X-ray, minor surgery, gynecology, the laboratory for dengue screening. Actually, dengue also one important thing is that I can see a lot of people also getting dengue during this pandemic. I don't know why. So yeah. So also they have an audiometry hearing test. Okay, very interesting as well.
And that's parts of OHD optional health services.
Okay. So once again, thank you, Dr. Noorasekin, and good night, everyone. Thank you.
Thank you, everybody. Thank you.